Hi, welcome to Team 4's presentation on mental health issues of the immigrant and refugee population. Our team members include Sandra, Anelia, Dea, and Juliet. Our presentation will proceed as follows. I will begin with an introduction of our topic, and then I will speak about the mental health of Canada's immigrants and the rates of mental disorders among Canada's immigrants. Juliet will present the detriments of immigrant mental health, and Anelia will explain the different barriers and facilitators to care. Our presentation will conclude with Dea sharing about the resources that are available to support immigrant mental health and some recommendations in how we can provide better services. Hi, I am Sandra, and I'd like to give you a brief background about Canada's immigrants, as well as talk about their mental health and the rates of mental disorders common amongst Canada's immigrants. The 2006 census found that close to 20% of the population, which equaled about 6 million, were foreign-born, the highest proportion in 75 years, according to Statistics Canada 2007. Between 2001 and 2006, over 1 million immigrants entered Canada. Approximately 60% of the newcomers were from Asia. 16% came from Europe, 11% came from Central and South America, and 11% came from Africa. Statistics Canada also says that approximately 70% of these immigrants settled in Toronto, Montreal, and Vancouver. Recognizing and appropriately treating mental health problems among new immigrants and refugees poses a challenge because of differences in language and culture and because of specific stressors associated with migration and resettlement. The health and mental well-being of migrant populations is influenced by complex and interrelated factors. According to Ornstein, 2002, the social detriments of health affect both physical and mental health. While the health of migrant populations can be influenced by similar dimensions of social detriments as that of mainstream Canadians, additional detriments due to their migrant status may also exert significant influences. Some argue that the migration and settlement process itself is a significant social detriment of health. It is also perceived that pre-migration contexts can affect subsequent post-migration health outcomes. For example, in a case of a war-torn home country, for instance, post-traumatic stress disorder may be a potential health risk that needs addressing in the post-migration context. In the case of family separations, mental health risk factors may be exacerbated. Those who have migrated to Canada as the only economic hope for a larger family in a country of origin bear a tremendous burden to be economically successful. According to a study done by Fazal, Wheeler, and Danash in 2005, the prevalence of post-traumatic stress syndrome, major depression, and general anxiety disorder in 7,000 refugees was as followed. 1 in 10 had post-traumatic stress syndrome, 1 in 20 had major depression, and 1 in 25 had generalized anxiety disorder.
Hello, Joyce and classmates. I'm Juliet Valdewesa. I'm from Group 4. I'm here to talk about the determinants of immigrant mental health. The source of this information is coming from Mental Health and Well-Being of Recent Immigrants in Canada from the website Citizenship and Immigration Canada. Determinants of immigrant mental health is actually categorized into 5 variables, and the first one is the socio-demographic variables, which includes age, sex, immigrant category, region of origin, and visible minority status. Immigrant category has been classified into family class, skilled workers, and refugees. And there are also immigrants that is coming from different region of origin, namely Asia and Pacific, North America, United Kingdom and Western Europe, South and Central America, other Europe, Africa, and Middle East. According to the evidence from the longitudinal survey of immigrants to Canada, immigrants coming from Africa and Middle East, as well as the refugees, are most likely to develop mental illness. Whereas when it comes to sex, depression, anxiety, psychological distress, sexual violence, and domestic violence affect women to a greater extent than men. The second determinants of immigrant mental health is the socioeconomic variables, which include the family income level, employment status, education level at landing. Some of the immigrants might have landed with a diploma in high school or less, trade certificate or college, some university, bachelor's degree, master's degree or above. Another socioeconomic variables is the number of individuals in immigrating unit, as well as marital status. It could be that the immigrant is married or under a common law status. Also, under the socioeconomic variables is the official language ability to speak English or French. According to the evidence from the Investing in the Health of Canadians, low income and low social status has limited options and poor coping skills in dealing with stress, which will make them high risk for mental illness. The third determinants of immigrant mental health is the social networking variables. Now, social networks have been shown to have a positive impact on immigrants' mental health. The more support you get, the less likely an immigrant develop a mental illness. Now, these social networking variables includes presence of family, support from ethnic and immigration associations, community organizations, as well as support from the religious groups. The fourth determinants of immigrant mental health is the health utilization variables, in which there is a problem accessing the healthcare services. Immigrants may have problems in finding a doctor who is accepting a new patients, and also most of these immigrants landed Canada without insurance plan. And another issue is that those immigrants who live from remote areas wherein transportation is a problem, and that makes healthcare services not accessible. Regional residents such as Ontario, Atlantic, Quebec, Prairies, British Columbia is included as variables to immigrant mental health because it reflects the possible variation in the way the healthcare services is provided across the province. The fifth determinants of immigrant mental health is the psychosocial variables. Psychosocial variables provide insight into the interaction between a variety of factors, including those determinants that I have already mentioned a while ago, such as demographics, economics, social networking, and health utilization. Psychosocial variables also includes the perception of the settlement process, in which some of the immigrants may not be satisfied about the settlement process that raises their anxiety level. In addition, stress adjusting to life in Canada, loneliness, lack of family support, issues with personal and family safety, including the family abroad, are among the psychosocial variables that may be a cause to immigrants to have a mental illness.
Hi friends, my name is Anila. I am from Group 4 and now I am going to present the topic Barriers and Facilities to Healthcare for New Immigrants. Newcomers to Canada experience a range of barriers to quality healthcare, such as complex health insurance eligibility and entitlement rules, limited pre-arrival healthcare, limited language and literacy skills, lack of familiarity with the Canadian healthcare system, and factors related to gender and culture. Next, we can see what's meant by barriers to healthcare. A barrier to healthcare is anything that restricts the use of health services by making it more difficult for some individual to access, use, or benefit from care. There are different types of barriers. First, we can see problems with eligibility and entitlement. The eligibility rules and length of time that immigrants must wait for landed status and healthcare vary significantly across the country. What health professionals can do: educate patients about their immigration or refugee status and how it affects healthcare access. Circulate clear guidelines for practice staff and share information with newcomer patients on the care and entitlements of different groups. Next barrier is lack of care provider knowledge and skills. A health professional's lack of knowledge can be a barrier to quality care. In this situation, the health professionals can know about your patient's immigration status and policies at local hospitals or clinics concerning newcomer eligibility and emergency care. Also, local community resources that facilitate healthcare and access. And the next barrier is limited access to physicians. There are few family doctors with appropriate language or cultural skills accepting newcomer patients in some areas where they are needed. What health professionals can do? They can consider networking with physicians and care providers in the region. Another barrier is patient unfamiliarity with new systems. Be uncertain where to find healthcare and health-related help. Be unfamiliar with their rights to access healthcare under provincial and federal insurance plans. What health professionals can do? Help patients to access information about navigating the Canadian health system. Another barrier is limited pre-arrival healthcare. Incomplete pre-admission examinations and assessments, patients not knowing their medical history. These are some of the pre-arrival healthcare barrier. And another one is precarious finances. Newcomers may avoid or delay care if they cannot pay for services. What health professionals can do? Be aware of eligibility rules for health services. Help newcomer families to connect with community social services that support care. Next, we can see the other barrier, mistrust of government and services. Immigrants or refugees may not seek care if they believe that their health or personal information will be used against them. What health professionals can do? They can convey strong messages that patient information is confidential, also provide printed reminders and use tracking systems to improve patient attendance and monitor access to care. And the other barrier is language literacy and cultural barrier. Differences in language or ethnicity between care providers and patients, and lack of reliable professional interpreter services. Family dynamics or traditions in some cultures prevent women from receiving screening, prevention, and treatment services. What health professionals can do? They can communicate openly. Also, promote educational programs crucial to the delivery of quality care. Raise cultural awareness and cultural competency among practice staff. And in conclusion, health professionals have a great responsibility to understand the barriers of the newcomers and help them to overcome it. Thank you.
Resources for immigrants. There are many available resources for immigrants. The first one is that Support to Immigrant Services Organization, in which CIC funds 100 of organizations that help the newcomers settle into life in Canada. Other one is that Immigrant Settlement and the Adoption Program, that is called ISAP. This program is designed to help new immigrants with immediate needs by referring them to economic, social, health, and cultural, education, and recreational facilities. Instruction for newcomers, that is called LINK. The objective of LINK program is to provide language training to adult newcomers so that they can learn to speak one of the Canadians' official languages. The host program match newcomers with a volunteer familiar with the Canadians' way, and the resettlement assistant programs. Recommendation for service improvement to immigrants. The first one is that support integrate community-based mental health services in which they address the social determinants of immigrants' mental health, recognize both the challenges and resiliences of a diverse group of migrants, that is newcomers, immigrants, refugee, precarious status. Second one is that support educational and training that provides the public education companions directed at a diverse group of migrants on the mental health system, that is either acute and community based, and how to access the appropriate service. Recommendation for service improvement is to support the policies that remove the barriers to economy and social integration of newcomers, for example, through the recognition of previous training and education. And last but not least is to support the longitudinal and the comparative research on migrant mental well-being that considers the multiple determinants of migrant mental well-being through the interdisciplinary approaches and the community academia alliances.
Immigrants and refugees are often coming from situations in which they have survived tremendous environmental stress, political persecution, and other types of hardship. And the immigration process itself and stressors associated with settlement in a new environment can increase vulnerability to mental health problems. By understanding the detriments of immigrant mental health and barriers to care, we can better serve our Canadian immigrants and refugees. When we are aware of the available resources and work towards improving our services, we are giving our immigrants the tools they need to support their mental health during their settlement in Canada. Thank you for watching our presentation on mental health issues of the immigrant and refugee population.
If you have any questions regarding our presentation, please feel free to contact us through our course email.